الو. يس. مصانع الشركة خارج جنيف، مشان هيك قررنا نزور المكاتب ومركز الأبحاث. الفيلم اللي رح تشوفوه بعد شوي مأخوذ من أرشيف الشركة، وفيه بيشرح امتيازات وخصائص فيلر الديناميكي حسب وصفهم.
What's the difference between what we may call the classic filler and the dynamic filler?
Yes, with the classic filler, it's the older technology. It's not containing lidocaine. With the dynamic fillers in Teoxane, we have a patent technology with the RHA. So this is a resilient hyaluronic acid. And this has been created with a patent technology to match with the movement and dynamism of the face. So as the muscle moves, there will be natural movement with the fillers.
For people who will be injected with filler, what difference they will feel?
Well, first of all, as it's containing lidocaine, there will be less pain. Second of all, it will be natural. So as you actually have the filler injected, you will not be able to feel the bulkiness of a filler.
Okay, it's more dynamic as its name.
More dynamic, yes, absolutely.
So can you tell how safe it's comparing to other fillers?
Right, so this is going back to the technology. So in this RHA, the resilient hyaluronic acid, the degree of modification is below 5%. So in turn, what this is doing is as the long chains of hyaluronic acid, there's less BDDE. And this solvent reagent is cleaving the long chains. So in terms of safety, in terms of duration of action, in terms of the overall efficacy, it's going to be better, yes, advantageous.
I've myself tried the dynamic filler for 2 years now, but I cannot tell from my own experience. I need to know what's your experience regarding stability of the filler, safety, and durability.
Yes, so in Teoxane, we pride ourselves on the manufacturing and the research and development. So we have a well-equipped manufacturing facility that is working and focusing on development, as well as working on the clinical trials. So we have the FDA approvals for the RHA range.
Interesting. And you start marketing in the USA now?
We are in process, yes. We're in process to enter the market.
Very interesting. 2 more questions, Nazila. What's the other different location that we can take advantage from dynamic filler other than the classic filler?
Yes, so you're the expert here. So I think in each and every one of the products, from RHA 1 to 4, we have different face indications. So it's specified for specific face areas to have the optimized patient outcomes.
So like which area in the face it might be work better?
Yes, so in the neckline, in the lips, in the folds here and under eyes.
Nasolabial fold.
Yes.
Interesting. One more question. Can we mix the classic filler with the dynamic filler? Is there any contraindication or complication if we mix the both sides? You know, most of people now used for a long time, for years, classic filler. Maybe they will be a little bit worried if there's any complication if they mix the dynamic filler in a patient used classic filler before.
No, so after a period of 6 to 9 months that the filler has been injected, they can switch to the dynamic filler, so there's no complication.
Interesting. One last question, Nazila. Everybody may expect that it might be this new technology, it might be more expensive. Should people expect the prices of the new filler is much more higher than the old filler?
So as a premium product, you would expect it to be more expensive, but around 20 to 30% increase.
Excellent. Thank you, Nazila. Thank you for the nice talking.
Thank you very much. Nice talking to you.
أنا شخصياً استخدمت فيلر ديناميكي على مدى السنتين الماضيين، وأعتقد أنه ممكن يكون أحد منتجات الواعدة والفعالية جيدة. لكن بالتأكيد القرار النهائي رح يكون للأبحاث والزمن.